In our practice, we see patients from the start of when they're born in their pregnancy or even when they're in mommy or at the end. We call that from the womb to the tomb. The reason we see all those patients and all those age groups is because chiropractic is good for all patients, but the question always comes up is, why are you seeing babies? Why do you see so many babies? If you scroll through our social, you'll see there's all kinds of baby pictures. Why do people bring them to us? The truth is that we're really successful at colic, and it's just not our clinics, it's chiropractic in general. A colicky baby, if you're not familiar, if you are familiar, you definitely know what that is, but it's really based on the rule of threes. A child will cry for 3 hours upon 3 days duration for approximately 3 weeks. I don't know if you have any kids or you've heard a child that's infantile colic, that they scream bloody murder for 3 hours, and there's nothing that you can really do to help them except for chiropractic care is super effective. Why? Because when a chiropractor gently, with his pinkies, barely touches at the upper part under the ear, there's a nerve that's there, okay? He touches the bone, but it's the nerve that's the most important that he wants to activate. That nerve that he activates is called the vagus nerve. You may have heard of it. This is not like Las Vegas. Vagus nerve controls all of your rest and digest. It causes you to calm down. Vagus nerve is very in tune with after Thanksgiving meal, the sleepiness, the tiredness, okay? When a baby has birth trauma, going through a small place to be able to get through, if there were forceps used, if they didn't go through the canal and it was a cesarean, all different babies may have cervical trauma, neck trauma. That puts pressure on the vagus nerve. And why is that nerve so important? Because it allows your stomach and GI system to function like it's supposed to. So we get those babies screaming bloody murder, and we make one small adjustment and touch a little spot on their tummy, and all of a sudden they just mellow out. Mom thinks we did something magical. I'm gonna tell you it's not. It's a very, very scientific way of doing things, and it's activating the vagus nerve that causes their digestion to relax. We see fantastic resolution. There's a research study that's out right now that says chiropractic is 94.7% effective for a colicky baby. Now, I'm not gonna tell you that we're going around to fix colic. That's not what we do. All we do is stimulate that nerve, and then the body does what it's supposed to do because that's exactly how it's designed. We just make one small minor tweak to the design and the patient gets better. So what I want you to know is why we see patients from the womb and to the tomb is because there's all different kinds of things, and you were made perfectly. We might have to do a little tweaks or adjustments, but to get you back to normal and perfect, that's exactly what we want to see. Dr. Grizz at 918 Chiropractic.